The next speaker is Dr. Nawab Shafi Ul Mulk, who is a Specialist Radiologist in Dubai Health Authority and Ministry of Health. Dr. Mulk is a cross-sectional imaging expert with 15 years experience in UAE hospital and fellowships in UK and USA. He has been credited for successful implementation and pioneering of teleradiology in the UAE and widely acknowledged for his contribution to healthcare. He is also the director of GLOBAL HAWK Telemedicine and Multinational Mulk Group of companies spread across 33 countries. Dr. Mulk will be talking on the latest teleradiology and image application and technologies. Welcome, Dr. Mulk.
Thank you very much for an excellent introduction. Good evening. Assalamu alaikum. My dear esteemed colleagues, my friends near and dear, I always take pleasure to be on the platform of Arab Health. I was invited last year. Coincidentally, I was called in again, to my surprise, as the guest speaker to this conference. It was an honor in two ways. One, for the relentless efforts we took to bring teleradiology to this country. Number two, that teleradiology is taking such a key cornerstone in the radiology and imaging management. Unfortunately, I could not speak on the first day due to my very unavoidable circumstances, but I did promise the producer of this committee, if not the opening, let us close it well. So here I am. I hope I could add some little smiles and some good memories. A lot of people have been attending these conferences, and I'm pretty surprised that there's so many people still there. As the previous speaker was saying, she was out there catching the bargains of BSF. I'm glad and very honored to be speaking in front of such a light and enthusiastic audience. I'll quickly take you through the history of radiology and imaging. A short journey is as amazing as what teleradiology journey is now. Starting at 1895, the X-ray, a simple reads on a view box, to what we are doing, a virtual teleradiology with interactive between physicians and the radiologists. The birth and transition of teleradiology is as exciting as radiology is. As we all know, teleradiology kind of started. It was more to overcome the perilous or very uncomfortable night calls, which was called night hawking. But now teleradiology has become a very integral part of radiology and imaging. It's taken over from the night to the day hawking, if you call it hawking. So it's an overall, teleradiology is becoming a very essential part of most of the radiology and imaging management. Few pertinent reasons why teleradiology has to come in, because as you go through the talk, eventually you'll understand we all are moving in this direction sooner or later. We have the advancement in radiology, a shortage of radiologists, an increase in workflow. At the rate we are getting the post-graduation inside is hardly 1 to 2% compared to the increase of images of almost 140%, which is expected in the next 5 to 10 years. Teleradiology transition. From a physical to virtual presence, from a standalone to mobile PACS, a PACS which would cost millions earlier is coming at a very affordable and reasonable price. From a transcription to the speech recognition, which for me it's a boon for my GST panel, because almost 100% speech recognition is possible now. From ViewBox to DICOM software, from desktop to roll-on laptops, from hard copy storage to online archiving. Why teleradiology? Yes, people think it's just an add-on value. At this moment, very convinced, and I don't know how many people in the audience would agree with me or disagree, but eventually down the lane, I think this is going to be a very much part of our system. As I was saying earlier, radiology cost is spiraling with billions of equipment coming in. The technology is becoming absolute. What we have today is becoming like old-fashioned, or a new technology is always taking over. We have 140% increase in the annual imaging procedures by 2020. 50% of radiologists are supposed to be over the age of 50. Imaging procedures are outpacing the number of radiologists graduating. So what we're looking at is only the tip of the iceberg. I think we are going to have the crisis of specialist radiologists or the esteemed radiologists in this world. Teleradiology eventually will be a balancing act. The average workflow load per day is generally a radiologist can do 50 to 70 cases. Practices that use teleradiology performed more than 25%. PACS, 3D reconstruction, computer-aided diagnostics have made diagnosis faster and accurate. Teleradiology advancement is rewriting healthcare standards. Fast turnaround, 4 to 5 minutes to result in minutes. Speedy download of images from minutes to seconds. Mobility in interpretations. Evolving workstation from hard boxes to mobile devices. Latest radiology applications and technology is incredible and a very amazing journey. As they generally say in teleradiology, we shift images, not the patient. So it's all about information, networking, and moving the images, how fast we could, the uploads, the downloads, and the workstations. Now from the standalone mobile PACS, retrieving CT/MR images wirelessly from PACS, MTR readiness, downloading of large data. You could literally have a mobile PACS for most of the hospitals with this accessibility. In the sense, most of the clinicians and radiologists can carry their mobile PACS in their hand and access the PAC from any part. From the transcription to the speech recognition, as I was just telling you, speech-enabled reporting has tremendously increased. We did have the problem when we started the teleradiology. People, especially the radiologists, could do 50 to 60 cases even if pushed on a very hard day. But I really like to add here, not being too commercial on people who are the producers of speech recognitions. This is a very remarkable tool which has added at least 30 to 40%